The upcoming announcement by the Trump administration could ignite fierce debates by linking maternal use of acetaminophen, the main ingredient in Tylenol, to an increased risk of autism in children. But here's where it gets controversial. Despite this bold claim, scientific evidence has yet to conclusively prove any direct cause and effect relationship between the two. U.S. Secretary of Health and Human Services Robert F. Kennedy Jr. spoke publicly about this topic during a press conference held at the Department of Health and Human Services on April 16, 2025, in Washington, D.C. White House insiders hint that alongside the autism and acetaminophen claim, there will be proposals suggesting that leucovorin, also known as folinic acid, a form of vitamin B used primarily in cancer treatments, might serve as a potential therapy for autism spectrum disorder. President Trump himself previewed the event, saying, "We're going to announce something huge, possibly one of the most significant medical breakthroughs in our nation's history. I believe we may have found a solution to autism." This marks the administration's latest controversial approach, which increasingly challenges established scientific views on a variety of health issues, including vaccines and abortion-related medications. Critics argue these moves aim to undermine trusted scientific consensus while pushing a specific political agenda. Secretary Kennedy Jr. has long focused on autism, pledging early in his tenure to identify its causes quickly. By September, he said, and has pointed fingers at diverse factors ranging from artificial food dyes and vaccines to common painkillers like acetaminophen. Yet now the reported rates of autism diagnoses have tripled over the past 20 years. The overall use of acetaminophen has remained mostly steady, raising questions about a straightforward causal link. The scientific community widely agrees that genetics play a pivotal role in autism. The disorder often runs in families, and studies of identical twins show that if one twin has autism, the other frequently does as well, underscoring strong hereditary influences. Some smaller studies have found an association between prenatal exposure to acetaminophen and higher chances of being diagnosed with autism spectrum disorder, ASD, or attention deficit hyperactivity disorder, ADHD. However, the largest and most comprehensive study to date, a collaborative effort funded by the National Institutes of Health involving researchers from the US and Sweden, found no evidence supporting an increased risk from acetaminophen use during pregnancy. These findings were echoed even before the study's publication, when a U.S. district court dismissed claims in a product liability case related to acetaminophen. Professional groups, such as the Society for Maternal-Fetal Medicine, still recommend acetaminophen for managing fever and pain in pregnant women. They emphasize that untreated fevers, particularly in early pregnancy, can lead to severe consequences like miscarriage, premature birth, or birth defects, thus highlighting the importance of carefully weighing risks and benefits. The administration's anticipated report will also discuss leucovorin as a possible treatment or preventive measure for autism. This idea is based on research indicating that many individuals with autism may have metabolic differences affecting folate transport to the brain. Leucovorin can potentially bypass these metabolic blocks, offering a route to address these deficiencies. Despite this promising biochemical rationale, the current evidence supporting leucovorin's effectiveness in treating autism remains limited and preliminary. The Autism Science Foundation recently commented on this topic, noting that although 4 studies hint at a connection between low folate levels during pregnancy and a higher risk of autism, this area of research is still in its infancy. The Foundation stresses that more robust studies are essential before any definitive conclusions can be drawn. This unfolding story raises provocative questions. Should acetaminophen use during pregnancy be reconsidered based on early associations, or does this risk remain speculative without stronger evidence? And the proposal to repurpose cancer-related vitamins for autism treatment, could this be a breakthrough, or merely an unproven hope? These are exactly the discussions we need to have, and we invite you to share your thoughts and opinions. Do you agree with the administration's direction, or do you think it threatens to blur vital lines between science and politics? The implications of this controversy are vast and deeply personal for many, making it all the more critical to approach with open minds and rigorous inquiry.